even in our medical education, and also because the infant survival is very closely connected to the survival of the mother. A maternal death is considered a very bad and a devastating medical event, so much so that the WHO will go to the extent of analyzing each and every maternal death. If a maternal death happens in a hospital, the whole hospital kind of comes to a standstill, and the media comes, and there is a lot of emotion and a sense of loss attached to a maternal death. And at the same time, there are so much of cultured bodies of thought about the mother, like the mother is the Buddha at your home, Gedara Budun Amma, and a mother who strives alone in life would be called an iron woman or a mother courage. Do you think that perhaps, and also if a mother goes through maternal depression following a childbirth, it is actually a very seriously considered condition. We don't even think whether maybe fathers also go through paternal depression and so on. So do you think sometimes the emotional world of fathers are sort of diminished in our culture or diminished from our medical practice? Do you think something like that?
Yes, I think like this movie Beauty and the Beast, the beast is kind of personified into a stronger figure. I'm not saying fathers are beasts, but then like in the cultural aspect, we expect the fathers to be sturdy and straight-faced, and a crying father is not kind of a normal thing in the society, but then they cry inside and it is not accepted or thought of it, like they carry this thing inside their hearts. And when it comes to the patients, like you said, we have a lot of gravity on the mothers, but even when there is a patient, a male, you really need to think that it has a pregnant mother in the sense of that.
Right. So with that, we go on to the next song at the Humanitas program. This song is sung by Deepika Priyadarshini. It's called Piyanani. It covers the themes of a daughter who is thinking about her father, who is no more. For this dance, let me call upon Gihani Jayawardena from the 2015 batch on stage. Prasad.
Me
That stunning performance by Ihanjala from the 2015 batch. Absolutely emotional song. Sir, are you okay? Sir, there are so many emotional references in this song about fatherhood, the loss of a father. So can I refer to some of the ideas in this song? It starts by saying, how did you take me to the path of righteousness without ever hitting me or punishing me? Can I first ask you, were you ever hit or punished as a son?
Yes. My father was a teacher. So obviously that died before very much was accepted. And then we started on punishment. I can remember how we punished. They never got never hit me very well. And my 2 months after this, she was elected. And after that one is passed, I was my hand. So if I'm entitled for about 100 left, but I just give it about 2.
Here at the Humanitas, we don't endorse corporal punishment, sir, but go on.
So, my opinion about it, I like my father and I never hate him. But another thing he tries to convince me by he did not stay.
So he was not successful.
So, as his son, I never hit my children. I've never scolded them. I never hit my children. But I'm very, very stubborn father. I'm compromising most of the time. Particularly if they're young, they're quite big now. So I have to particularly now I have a child and I'm feeding them and have to do things. But when they were small, but I have never told them that their marks are low. When teachers asked me from school and I told them, look, I have been told more than by your teachers than by my teachers.
Right. So with this song, Lavanya, can I briefly ask you, this song is a song about the loss of a father, and he says that you are not here for me to look after you, and you are already in a good place. May you from that divine place go to Nirvana. This kind of very, very sentimental thoughts about the father. So how does a daughter process not having your father to look after and to do your best? Very briefly.
There are 2 things I would like to bring out in this. When I was in my early internship days, there was a patient admitted for a father, admitted for hemorrhoidectomy or abscess or something. And after they did the surgery, after several days he passed away due to cardiac arrest. It was quite unprecedented and it was not expected. The daughter, who was around my age, came to me and told me that I hope this kind of a thing won't happen to you ever. He just got admitted to do a small surgery, and the loss in that father's the daughter's face and the gravity of the things we do. I mean, he didn't die because of anything we did, but it just happened. kind of molded me into not dealing with the emotional weight of clinical medicine, and I drifted to laboratory medicine side. It's not the only fact, but it is one of the factors. And on a personal note, as I mentioned to you earlier, my father passed away. He was a surveyor, and he was surveying some land plot in Haldungulla when he passed away. He has walked 5-6 kilometers with his assistant and into the thicket, and he didn't have any diseases or any treatment for anything before that. Within the forest, he has touched his heart and just passed away. And it took like 5-6 hours for the other people to get the body out of the forest. I was obviously in Colombo, and before he could make use of his doctor daughter, he just passed away. So he has always been a sun and moon. I couldn't be a fraction of it. Yes, and these two incidents shaped me to be more proactive in managing and empathetic with regards to patients and fathers, and personally not being strong enough to deal the emotional burden of clinical medicine.